Hello, welcome to another episode of the All-Star Podcast. I'm Katie Ray.
I'm Dr. King.
And we are so happy to be here with you guys today. Please check our other podcasts out at YouTube, Spotify,
Google.
Googs, the Googs, iTunes?
iTunes. We got them all. All right.
Wherever you get your podcasts from. So also leave us a review. Ask us some questions. You can send your questions to asvcpodcast at gmail.com. Or you can leave us a question on Facebook or Instagram, all that good stuff. So we'll talk about
Whatever you want.
We'll talk about whatever.
Yes.
Personal questions, vet questions, business questions, whatever. Okay, so for this show, we'll answer some questions. We'll talk about some veterinary things, and then we'll watch some funny clips where you guys get to watch the videos with us, and we'll describe what's happening for those that are listening, and you'll see our genuine reactions.
Yeah, if you're listening live, send us in a shout because we can shout back. And we're sorry we're a few minutes behind. We were practicing some.
We're a few 60 minutes behind.
Okay, a few 60. What's the difference?
A few 60. We're getting together.
We're practicing our emergency stuff.
We're practicing our emergency protocols and how to better assess and quickly assess patients that need emergency care.
Yep.
So
that's what we were doing.
Yep. Because
we were in a thing. We were going
honed in.
So we didn't want to interrupt while we had the magic thoughts.
It was going well.
Yeah.
It was going well. Yeah, so, we were on a roll for sure. So
yeah. It was very cool.
Okay, so it's Memorial Day week. Did you have a good Memorial Day weekend?
I did. I have to say that originally I thought my Aunt Janice wasn't coming, but then she did come.
Yay! And she brought the whatever.
She, bless her heart, brought the lettuce and brought some radishes because Richie likes radishes. And then
it's weird.
Yeah, and but she was just there to visit, so she was great. And then I thought, oh my gosh, I forgot to mention that my other aunt. So these are the things I think about food, right, all the time.
Mm-hmm.
My other aunt, my Aunt Nancy.
I have Aunt Nancy.
Oh, really?
Yeah.
My Aunt Nancy's so sweet. Anyway, they all are nice, very sweet people. But Aunt Nancy, every Memorial Day party brings strawberry rhubarb pie, homemade, crust, pie, the whole freaking thing. Now, you have to remember, this family's ginormous. She brings one pie. There could be some fistfights over this pie. Like I've learned over time now that I go get my piece of pie and hide it. I before anybody gets there. She comes in the door. I'm like, what'd you bring? Pie. That's what I thought because that's what she brings every time. Yeah. Oh, she also brings this really good potato salad, but the pie is really, literally my focus. I go cut a piece of pie. And I put it over there in the corner because as soon as you turn around, that pie is gone.
Yeah.
They always blame my dad.
And you let them.
Yeah, pretty much.
I'm going to let my dad take the rap for this one.
So I got to have pie. I got to have homemade lettuce. I got to get homegrown lettuce, which is awesome.
That is awesome.
I got to see all my cousins, which were hilarious because one thing I love about my cousins is that I could not see them for 6 months, and I see them again, and it's like I just saw them yesterday.
Yes.
They can rib one another.
Yeah.
We were laughing our butts off because one of my cousins said, all my aunts, sorry aunts, don't listen, all have fat ankles, okay? So one of my cousins said to me, do you really think, Emily, Shelby and I are sitting here talking, do you really think we are going to have fat ankles when we get older? And I was like, guys... I was like, I don't know. I really don't know, but I'm thinking yes. And they were like, oh my God, you're ruining it for us. Well, you don't, that's not something you talk about with people you don't feel comfortable with.
Yes, that's hilarious.
So we were just going, it's just awesome. You can get back together with them. It's like you just saw them yesterday. They're fun. They're just great.
Being able to do that. I can't figure out how to get this live video on, which is why I keep looking at this. How do you?
Harrison, our live video. How can we get it on the computer? Step into the frame.
Please.
Come on, let's show everybody who you are. This is Harrison. He's the brains behind the project.
The brains. Okay, so
What did you do?
What did I do? Memorial Day weekend. I went to a birthday. Oh, my twin was in town. That's what it was.
Oh, nice.
My twin was in town. So it was really, really nice to see her. We got to surprise my mom not once but twice. So
that's hilarious.
Molly came into town literally for 52 hours. And my family, looking good. Dr. King's face is frozen in a hilarious way. Okay, so my family had kind of planned a really late, like 2-week late Mother's Day / our parents' 40th wedding anniversary dinner for Sunday night. And my brother set it up so that my parents thought that they were just going to go to dinner with Jim and Jess, but then the other kids would be there because I've got 2 older brothers and 2 sisters, so there's 5 of us total. So Molly is like, hang on, I can make it to Indiana because she lives in Waco, Texas. Molly said, I can make it to Indiana for 52 hours and surprise them at this dinner. Well, then it was like, well, I'm going to get there Friday morning. I probably shouldn't wait until Sunday to let my mom know that I'm in town.
That's probably a good idea.
So I said to myself, my mother doesn't know that I'll be at the dinner on Sunday, and I didn't get to see her on Mother's Day. So why don't I tell her that I'm going to take her to dinner on Friday night, and just the 2 of us. So I invite her to dinner, and then my mom and I get sat, and I was like getting the reservation ready. So they were like, what's your name? And I was like, the reservation's under Katie. And they're like, great, for 3? And I'm like, no. There's only 2 of us. Like, there's only 2 of us. Why'd you say 3? My mom didn't think anything of it.
Right.
So Molly goes around the back of the restaurant, comes in the back door, waits for my mom to be like looking down, and comes up to the table and says, can I get you guys all like started with an appetizer? My mom looked up at her and literally went, ah! And like screamed at this restaurant.
That's so
they both
cute.
started crying. It was amazing.
Oh, that's so cute.
So we got to have a really, really nice dinner with them. And then Sunday rolled around, and all 5 of her kids were now at the restaurant with our significant others minus Charles because he was not able to make the trip with Molly. So she walked into the restaurant, and then there's all 5 kids and their spouses, and she didn't cry again, but I don't know how she knew, but she was like, I knew it! Like, so excited still. And then my aunt was there as well, so.
That's cool.
Yeah, it was so much fun. She was very, very, very excited. And then I went to a 1-year-old's birthday party, went to a cookout on Sunday. Have you ever played the game Telestrations?
I feel like I've played that game before.
It is one of the funniest games I have ever played in my entire life.
It's a board game, isn't it?
It's like telephone, but you draw pictures instead.
Okay.
I played it like 2 or 3 times over the whole weekend, and I was crying. I was laughing so hard.
I'm going to have to pull that out.
So funny. Which, by the way, this is for Molly. We played one night, and Molly was laughing so hard at herself. Classic Molly. She was laughing so hard at herself because she put her hand inside this book, and she literally drew her own hand as part of like whatever her phrase was. Well, that book didn't get erased, so I brought it to my friend's house the next day. Molly was already gone, and someone like flipped through it and was like, whose hand is this? And then I got to laugh really hard about it again. So I'll have to tell her about that because it was very funny.
That is very funny.
Yeah, but yeah. So otherwise, I had a really good weekend. Running around with Molly is always slightly exhausting, but fun.
Yes.
I had to take her to the airport at 4. We had to leave Noblesville at like 4:15 in the morning on Memorial Day.
Oh my gosh.
You're off work. Surprise.
Guess what?
You're never sleeping again.
Oh my gosh. I'm sure she appreciated it. So
She did. All right. So what else is new this week?
This week.
We did a knee surgery today.
We did a knee surgery today. We did a extra capsular repair on a little dog.
Yeah.
You can fix the
Cute little
knee. She had a cruciate rupture. She had a very loose knee, so she had ruptured that cruciate ligament in the anterior cruciate ligament in her knee. So her femur was rubbing on her tibia.
Femur was rubbing.
I guess that's how I always explain it to an owner.
Yeah.
Femur's rubbing on the tibia.
Yeah,
So,
because the thing's not there to hold it.
Yes.
So it's all like beep.
Because that cruciate ligament, that anterior cruciate ligament keeps that forward thrust from happening. So
Yep.
once it pops, then the dog, every time it puts its foot down, its femur shifts forward. Yeah, not good. Doesn't feel good. They can tear their meniscus.
Yep.
So yeah, we stabilized it, and
Cool.
she's recovering nicely.
That's good.
We don't use that technique in heavier dogs.
Yeah.
But there's better techniques in heavier
Better
dogs.
techniques for the bigger dogs, but it works great for the small guys.
It does.
So, you want to know what happened to me today?
Yes, I do. Yes, I do.
You do want to know what happened to me today?
Yes, I
Okay,
do.
so everybody, if you haven't seen our day in the life videos yet on Facebook and YouTube, no?
You got to check them out.
Yes. Okay, so on Facebook and YouTube, check out our day in the life videos.
We think they're hilarious.
They're hilarious, but they're also just like a good insight of to what the day-to-day life in the veterinary field looks like. So
Right.
you'll see you'll hear us talk about real life cases. You'll see some surgeries, even some dental care, and just
puppies.
some puppies for those. So I made a joke because like this probably would never be in the day in the life video for good reason, but this story
It should have been in.
this story is a very, very real part of our lives here, unfortunately. So today, we had this little girl come in, and you know how when you're scared,
Like a
you're
human
always,
little girl?
I was gonna poop my pants,
Okay,
right?
wait. Are we talking about the human little girl or a little girl dog?
The little girl dog.
Okay, got it.
Little girl dog. So when you're really scared about something and you're like, oh my gosh, I almost pooped my pants. Well, fun fact, dogs
usually
and
don't say that,
cats.
but okay.
Actually, I hear you say that all the time, Dr. King. Thank you.
Okay.
No, dogs and cats, when they're scared, they really do pee and poop everywhere. So, like, that's just a normal response to some
I was
pets
going to
when
say,
they're really nervous.
what is that related to?
The polyvagal theory.
Yes.
For
Okay.
realsies.
Okay.
So, yeah, I think Suzanne can correct me if I'm wrong, but the polyvagal theory is like, when you're really scared,
Right.
your body like eliminates or it gets rid of it evacuates the elimination system,
Right.
so that it cannot waste energy on its
that.
like digestive system, and it can use its energy for the fight or flight response. Really, okay. So that's basically the gist. So unfortunately, you can't ration with the pets. Hey, this will take 4 seconds. Just sit still.
It's all good.
You're going to be fine, I promise. So they get really nervous. So we had to draw blood from this little girl, and she was very nervous, bless her heart, and she pooped and then peed. And when I went to go pick her up, she started pooping again. Only now the poop had made its way to like basically diarrhea.
Oh no.
Yeah. Oh no. So I'm
What
sorry
time in
that
the-
this is a
what
really
time-
gross story.
What time in the morning was this?
7:30, 7:45. I'd only been here for 45 minutes. So this is a true day in the life, and I'm very sorry that this story is gross. But so I pick her up, and she just is letting her systems go. Only she tries to kind of alligator roll while I'm picking her up, so her back end kind of swoops in a circle.
Oh no.
And she literally flung poop everywhere.
Yeah.
Sorry, this is so gross. So I'm holding her. So she hits my shirt, my pants, my shoes, and it hit my shoes so hard that it made it to my socks.
Oh dear Lord.
So and it was on my arm, my hands, literally everywhere.
That's what you wanted to start over.
Yeah. I'd been here for 30 minutes, so luckily we've got extra changes of clothes here, so I basically took a shower and changed my clothes, and I put my shoes, socks, shirt, tank top, and pants all in the wash, and I had to borrow shoes, booties, pants, and a shirt from somebody else,
Yep.
which luckily we had, and so now I've been rewashed
You've
and
been
everything
rewashed. You're
looks
clean.
good.
Yeah.
But that,
sometimes you can't tell that's going to happen.
You can't.
Like the dog's going to do that.
Yep, they
Sometimes they
can't.
don't like. They're not outwardly
they don't like posture like they're going to poop, it just comes out.
right, and they're not acting like they're
Yeah.
having any trouble with the scenario.
Yep.
But then it just
She was kind of just
starts-
frozen with fear.
right,
So.
and then it just starts rolling out,
Just falling right on out.
rolling.
So it's hard to be like, you still have to remember that she's only doing that because she's scared. So I'm like, oh, little girl, like, it's fine. I promise you're going to be fine. And now I'm all like, watch out, everyone. It's a minefield over here. So
that happens with a lot of different types of waste, though, in our industry. Urine, poop,
Anal glands.
That's why we always tell people to keep a clean change of clothes. Because and it always seems like if it's going to happen, it's not the end of the day.
no, it is always the
It's
first.
always the first.
I think
beginning
she
of
was
day.
the first patient I interacted with today.
Yeah.
The first one.
Always that.
Yeah. For realsies. So yeah, so she's fine now, but and now I'm fine. But it was an experience.
Yes. Oh gosh. Okay, so anything else going on this week? I don't think that there's anything really else that big going on this week. We are going to, it's May. What is it? May 29th or something?
May 30th.
My watch is dead. May 30th. We are getting our new associate. Sounds like we're getting a new car. Our new associate. Just try around. Okay. Just had all these car commercials coming in my brain. Okay.
Yeah.
She is coming at the third week in June.
Yeah.
Ashlyn Duckwall. We're super excited to have her with us.
Yeah.
So we're getting ready for her, kind of getting all of her stuff organized and ready. Mm-hmm. So that's pretty awesome. We're pretty excited. She's graduating from Purdue.
Yeah.
She's in the class right behind Dr. Dudley.
Perfect.
So now everybody's from Purdue except me.
Oh.
Yeah, I'm really outweighed.
Yeah, pretty much outnumbered over here.
So whatever. I just have the orange building to make up for it, so it's fine.
You do.
Yep.
You do indeed. Yeah.
So.
And an orange car. So.
Yes, and an orange car.
Yeah. That's perfect.
It is. So so we're getting ready for that. What else is going on? Anything else? I don't know. It's kind of been with Memorial Day on Monday. It's been a short week, so
it has been a little bit shorter of a week.
You know, do we want to go into our question?
Let's do it. Audience questions. Questions from the audience. Beep, beep, beep. All right. Okay. So our question this week is, what can you expect for your first visit or a visit? Just your first visit at All-Star.
Okay.
I will see your first visit and I'll raise you all of your visits because we pretty much do the same thing every time. So, for your first visit at All-Star, you will be, I almost made a joke. You'll not be greeted and you'll be wandering the clinic looking for someone.
Wandering the halls aimlessly.
No. So, for your first visit, we try to greet you at the door. And then we get if you have a dog, then we get a weight on your pet, and then we take you pretty much right into immediately into an exam room.
Right.
We offer you coffee, water, fruit snacks if you're interested, maybe some Hershey Kisses if you're feeling real fancy. Oh, sorry, Dr. King ate all of the Hershey Kisses.
I try not to. Just some days. Yeah.
Then the assistant will come in and they'll take a history, kind of go over what you're here for the day, whether you're here for your first puppy, your pet is sick, you just moved here, and kind of go over anything that you guys are needing for the day, any questions that you might have, and then we'll walk you through whatever it is that we recommend. So if you're here for vaccines, we'll walk you through the vaccines, the preventative care, what the exam is going to look like. If the patient is sick, then the doctor will come in after that and do a full nose to tail exam and listen to your dog, cat's heart, look at the eyes, nose, feel the belly, listen to the lungs, all that good stuff. And then just make some recommendations there. If it's, if your pet's not feeling well, then the doctor will make a recommendation on whether, x-rays are needed or blood work or anything like that. And then, but we always try to do a really good job of educating of what we're going to recommend and why we're going to recommend it, so that you know exactly what's happening every step of the way.
Right. We call it keeping clients in the know.
Keeping you in the know.
So I think there are a couple things that make us different. Wouldn't you agree? Well, there's probably a lot of things.
Lots of things.
But I really like for our cat owners that they come in the clinic and they go straight to a room. I mean, which everybody typically does.
Yep.
But especially for cats.
Yes.
Especially for moms that have 3 kids and a dog who isn't used to being outside the home or on a lead, and he's jumping and running, trying to get away from them.
Yep.
We try and get people straight to a room so that they don't have the stress of the lobby. And for cats, that can make a really big difference. Because they're they escalate. They're so volatile, and get so scared so quickly. So I think that's really cool that people don't have to wait to get into a room.
Yes.
And the only way that works is because I feel like we are timely.
Yeah.
So we do stay on time. It's something that we watch and monitor, make adjustments if needed, in terms of policies and procedures to make sure that we stay on time. But the other thing I really think is cool is that we check people out in the room.
Yes.
So again, when you're leaving, you're not checking out at a reception desk.
Yeah.
Trying to hold a dog.
12 dogs, your kids are all over the place.
Yeah. I mean, it's a recipe for disaster. And then we can make sure all their questions are answered.
Yeah.
And so,
Definitely. So you get, and then what else?
oh gosh. I mean, I think that the experience from the client standpoint of things is superior to anybody, just from the standpoint of education. I mean, I think that we're never in a hurry. We're always asking, if we answered all your questions, or is there anything else we can help you with, and so I think people feel heard, and I think that's of extreme value to people when typically in these types of scenarios, or at least in our industry, they're rushed in and out, and so I think that having their voice heard, especially if their pet has a problem, or they feel like they're not getting somewhere, I think that makes a big difference.
I think so too.
So
we're here because we care.
That's right. So I think that there's quite a few things, like, we could continue to list the things that make us different, but I think that the exam room experience is, I really like how we've set up the exam room experience.
Yes. Yeah.
I think it's helpful to the doctors. It helps the doctors be successful. It helps the room assistants be successful. Everybody, you can't stand to leave that mic alone, can you? You just can't. You're going to break it at one of these points. I just hope you know
I can't
that,
not
Harrison.
touch it.
She's going to break it. She breaks everything.
I wonder if you can see me mess with it in a second here.
Let's see. Let's watch.
No,
I bet you
don't
can. There, right about now. Ba-boom.
Look at my face.
I can't do it.
No, I didn't do it. Oh, no, we're talking about Okay, sorry. Sidetrack. But yeah, so especially with your first visit, we'll make sure that we take our time to explain everything so that you are aware of everything, every step of the way, from what is it, what does it mean, and even how much it costs.
What can we do about it? How much does it cost?
How much does it cost? All that, so that you're never guessing like, wait, what just happened?
Right.
Which is, that happens everywhere you go. You go to get your car an oil change, and they come back with, oh, we recommend you do beep bop bleep bloop zorb, and I'm like, what did you just say to me?
Right.
So,
I think we really enjoy too. I mean, the whole the creating a family experience. We encourage people to bring their kids in, or for kids, that doesn't bother us a bit if there's 5 kids in an exam room and a dog, and
we've got things for kids to do.
Yeah, but we really enjoy talking to kids about veterinary medicine, whether it be letting them participate in the physical exam, or listening to a heart. I had a few kids in the exam room the other day, and we basically did the exam together. Like, they stained the eye, they held the ophthalmoscope.
Oh, that's so fun.
They were like all over.
I would have loved that as a kid.
They thought it was so cool. I felt like the poor mom was probably like, aren't you going to do your job? Like, they're doing your job. No, I think she
are you actually looking at my pad? Yeah,
no, the kids really enjoyed it. But, it also creates a respect for the pet as well.
Yeah.
If the kids are having to, okay, you stand here and hold the pet. Okay, now you're going to do this, and so they really were into it,
That's fun.
And so it's things like that I think when we take the time to create those types of experiences for people, then it's memorable. It's good for us. It's more fun for us.
For sure.
As well,
and when you're relaxed and the client's relaxed, the pet is more relaxed. When the pet's relaxed, the client's more relaxed, so you're more relaxed.
Yeah.
And I think that's the 5th time I've said something like that on this podcast, but it's so true. So true.
Harrison, do you think that answers that question pretty well?
Yeah.
Do you think there's any other parts of it we should explain?
No, I think that's good.
Okay. Well, there we have it.
Well, that's good then.
I thought also cool. Did we say last time that we put that for the cats, we had 2 rooms dedicated for the cats? Did we say that?
I don't
for
remember.
Cat owners? Because we know it's so hard for cats to come into the clinic.
Yeah.
Cats
are special creatures.
Cats are the ones that should come in the clinic the most, because they're so good at hiding disease.
Yes.
They're called silent sufferers.
Yep.
So, but people think, well, and rightfully so. They're not acting any different. They don't look any different. There are so many things that can go on with them that you don't know about until it's too late.
Yep.
But yet there's the most difficult patient to get in the clinic as well. So that's completely understandable.
Yep.
And so it's interesting that they're the ones that need to come in the most frequently, but are the ones that hate to come in at all. And so you end up not seeing them often enough. So there are countless occasions where we have a cat, we haven't seen in 5 years, who comes in, you know, I mean,
all the time.
And so there are things we've created, I think, to make it easier for cats, you know, like certain exam rooms.
Yep.
And
The kitty cats tend to stay in one room so that it's not necessarily a cat only room, just because
there's just a couple devices in there that they can hide and they can. But, and then I think, you know, things we can do to help cats get here easier, because it is horribly stressful on the owner.
Yeah.
Try and shove your cat in a cat carrier.
Yep.
Is no fun.
Nope.
So, you know, if you think you want to bring your cat in and you feel like you should bring him in for routine care, just call us. We can help figure out how to make it easier.
Yep. Simple things like leaving the cat carrier out like days in advance so they kind of get used to it. And that's all I got.
Yeah, well, and I mean, drug therapy.
Drug therapy.
They do so well with, you know, if you give them just a low dose of an oral medication called gabapentin, you just take the edge off of them. They don't care about coming in and out. Yep. It's easy to get them in a carrier. It's easy to look at them.
Yep.
They have a good experience.
Yeah.
So.
For sure. I think that definitely helps.
Yeah. Maybe the next podcast we could talk about the cat friendly stuff.
Yeah.
You know, because I don't think have we talked about the cat friendly stuff yet? No. Maybe that's what we should talk about next podcast.
Yeah, our special cat mountain room.
Yes.
Yeah.
So we could talk
get all
about
those points down for the next one, for sure.
Why are you laughing at Cat Mountain?
It's Cat Mountain.
I said, can't stay, but love you.
Hi, Mom.
So I think maybe there's probably some, there's lots of questions that we could answer about cats and the clinic. Let's save that for next time.
Yeah, because we'll have to get some. I'm sure we can create a list of all the cat-friendly things that we're doing now.
Oh, and we could give them the websites of some cat info websites that are really good.
Yeah.
So, okay. And it's kitten season, so that might be helpful too.
Kitten mittens. Yep.
I saw the most adorable. Was she Himalayan, Harrison, that came
yesterday?
The baby?
2 days ago?
Yeah.
Yeah.
Oh my God, she was adorable.
And she was a sweet little angel.
She was confident.
I gave her microchip, and she didn't even
she didn't budge.
flinch.
Yeah, she's a confident cat. I mean, she was up and about and like, what? Yeah, exactly. She was adorable.
Very cute.
So, and then, we've been seeing quite a few kittens because it's about that time. So
it's about that time, eh, chap?
Kittens and puppies.
Yeah. Does not, yep. Yeah.
Summer.
Yep.
You know?
Yeah. Did I tell you about my sister's cat problem?
No.
Yeah. They just moved into a new house in Waco, Texas. And she said that they moved all their stuff in. Most of their stuff. And then the next day they all came and she brought the dogs. She doesn't have any cats. So you're like, how's this cat story? But she doesn't have any cats.
Right.
Exactly. So the dogs go into the house for the first time. Everything's fine. She lets the dogs out in the backyard.
Oh, no.
Dogs come back inside, and there are, like, visible fleas, like, just rampant all over the place, all over the dogs immediately.
My gosh.
Immediately.
Simperka.
So she comes to find out, the neighbor comes over and tells her, oh, yeah, there's a bunch of stray cats that live under your garage.
Oh, my Lord.
So she was saying how if you as a human got within like 3 or some odd feet of the garage, that the fleas would jump on you. There's so many fleas.
Oh, my gosh.
So I was like, call your landlord, get those cats taken care of, get the fleas out there. She's like, I'm just going to have to walk my dogs for a while. And I'm like, you just moved into this new house with a fenced-in backyard, like, and it's really big. Like, you should be able to let them roam. Oh my gosh. So get the landlord to take care of the fleas, but like.
That reminds me of that Pfizer who used to own Zoetis. Anyway, whatever. Pfizer did a study. They have a product called Revolution, and they did that study where they did it in the horse barn. Ooh. Do you know that one?
No, I don't.
And so they got called out to this one property, and it was a horse barn, and they were having a flea infestation, and they were using Revolution on the outdoor animals, and the property manager was like, we're not getting rid of it. So Pfizer decided to use it as a case study. And they... So the life cycle of fleas, right? There's a larval stage.
Yep.
Okay. So I'm telling you this, you know this. Okay. And
but they know.
Yes.
They know.
Okay. Yeah.
Maybe.
One of the parts of the study, they were in a pole barn, and what they did was they went up in the pole barn and looked down at the ground, Oh, God, it was moving.
Ah!
Oh, that was that many larvae in the sawdust of the pole barn that they could see it moving. And those poor people had to do colony counts. Like, so those poor... So they had to count, like, so they could know the population of fleas in the area.
Oh my God!
Because
was
then,
it 40 billion?
I don't even remember the number, but it was astronomical. So then what they did was they basically used it as a way of saying, like, okay, your revolution does work, but you're not putting it on correctly, you're not using it correctly. And then they started using it, and then they saw the reduction in the flea populations, like over 3 months. That's how they could start to tell people, okay, 3 months typically you're going to get rid. Oh my God, with the microphone. Holy crap. I'm going to kick your butt.
My bad.
Peace out. And so, yeah, it took 3 months to kill a population. Isn't that crazy?
That's disgusting.
Yeah.
That is super
Ever
gross.
since Leslie from Novartis used to show me, Elanco now, God, these drug companies can't stay in one place. She had that carpet model, and it had the larva in the carpet. Oh my gosh. I was like, Leslie, I cannot use that.
It's
People are going to
disgusting.
vomit in the exam room.
Yeah.
But literally, we used to go back to the day. We were so excited. Frontline came out, which is Fipronil, which doesn't do
Anything anymore?
beep now. I mean, it does some things, but not much. And we have these superior products that kill the fleas so fast they can't reproduce. Credelio, Simparica, Brevecto, NexGard, those guys are amazing.
Yeah. Stick with those.
Oh my goodness. I can't imagine.
Blah.
Remember when people used to bomb their houses
Yeah. Yeah. Yeah.
because you couldn't get rid of
Yep.
fleas? I mean, that was the, wow.
Yeah. Yeah.
It's amazing how far science has come in
Yep.
such a short time period. But yeah, pretty cool.
That is pretty cool. Fleas are gross.
Fleas are gross.
Ticks are worse.
Ticks are worse. They're both bad.
They're both
There's
bad.
just-
I just personally, ticks freak me out more than fleas.
Ticks freak you out more than fleas.
Yeah. Like, I don't know. Like, dog comes in and has fleas. If they, like, I'm okay with those. I'm hesitating because people are going to think this is really gross. Sometimes you can get the flea comb and you can scrub
yeah.
them, and you can get actual live fleas with
Yeah.
the flea comb.
Yes, you can.
So then I smear them onto a paper towel and smash them with my fingernail.
Oh, God.
See, that's why I didn't want to tell you that. Because it's really gross, but it's whatever. Like, fleas are like bugs to me, Like,
Right.
but ticks, I'm like, get away. Like, people respond to spiders like that. That's how I am with ticks. I'm like, oh, get it away, get it away, get it away.
Yeah.
I'm okay with spiders-ish.
Oh, gosh.
Ish.
I don't like any of them. And we're coming into that season. Ticks are going to be bad this year with as wet as it's been.
Oh my gosh, for real. Yeah, Griff was playing with a spider yesterday. One of the clinic cats was playing with a spider yesterday.
His face is going to swell up.
Yeah, I was like, Griff, how's that spider going? And Katie Roberts was like, spider.
He's going to end up with a
funny.
swollen chin. Something's going to happen.
Yeah, he's our special boy. Did you hear that Griff gained even more weight?
No.
So one of our clinic cats, Griff, keeps eating all the food. So Chief is really skinny because he just doesn't eat enough. He's not like he's not underweight by any means.
He's like fighter weight. He's like eats his meals in small portions.
Yeah,
and
he's definitely a fighter for
he's
sure.
like, I need food now. And then he eats it and then he's like, I'm good.
I'm good. And then Griff is more like, you know what? It's been about 10 minutes since I've last
need more
eaten. I should probably just lounge, lick myself, and then eat this bowl right here. All of it.
All of it.
So Griff is now 14 and a half pounds.
Yeah.
I don't know how to get him to eat less and not cut off the other cats.
No, what did Madeline say? Oh no.
Guys, I'm eating lunch. Sorry, Madeline. Sorry. Yeah, we've been talking about fleas and ticks and poop.
Yes.
Are bad.
Don't watch the Day in the Life series, Madeline, while you're eating lunch.
Yeah, wait till after lunch or before lunch
Or
tomorrow.
before lunch tomorrow. Right, exactly.
Yeah.
So, I feel like we're going to have Madeline on the podcast now because
we
she's
are.
been a frequent commenter.
Yeah. Just get my mom in here and Madeline.
Yeah.
For sure. Yeah.
Once Harrison figures out the Skyping route, we can have people from all over the place.
Let's Skype.
Yeah.
Yes. That would be fun.
Because I'm lining up the CBD oil person, so
Yeah.
that's going to be cool.
That will be cool. For sure.
The neurosurgeon.
CBD.
Okay.
All right,
All right. So, do we have any other questions that we need to discuss,
No.
Harrison?
'Kay.
No? We're good?
Then
Okay.
let's get on to funny videos.
Boop, beep, beep.
The part of the show where we watch some funny clips. I'm ready to laugh. Let's do it.
Madeline said,
She said, yes.
okay, that means
So it's not a yes, it's a yes.
that means like a totally, I'm in,
Yes.
sign me up.
Yep.
Tell me when to be there.
Let me hear your best yes.
Yes.
You sounded like Chief, the cat. It's more of a nasally like Valley Girl, like yes.
Yes.
You don't actually have to plug your nose.
That's not good either.
Give me one more.
Yes.
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 Can you? I'm getting a little bit of a yes from you, and it's more of a yes.
I can't do it.
You sound like the slug from Monsters
You're
Inc.
making me
The
laugh.
slug?
Yeah, like when Mike Wazowski comes in.
Mike Wazowski.
Yes.
He's like, I'm always watching. Like,
Oh, I'm always watching.
Yes.
I love Monsters Inc.
Yes.
We named our isolation ward 2319.
Yes, 2319.
2319.
Because nothing can be named a common name. They all have to have cool names.
Yeah.
We went through that the last podcast, I think. Didn't we tell
Did
everybody
we do
the
that?
names of our
Yeah, I think we
areas?
did.
Yeah.
All right, funny videos. The caption says, brah. Can you say brah?
Bruh.
Why this cat doing sit-ups under a car?
What
What's happening?
What is happening? That cat's stuck.
Is he stuck? What's happening?
His footsies are.
How are his feet stuck?
1, 2, 20, 50.
This cat's doing sit-ups under a car because we think it's stuck?
No.
Does it
okay,
get
he's probably
out
not
from under
stuck.
the car?
Do we see them move? Let's see. Let's hope that he moves. He stays there. I'm thinking.
I don't know whether to be concerned or not. This is not normal. Does that person not help him?
Oh, gosh.
I don't
That's like a
understand.
suspenseful movie. They just stop it right in the middle.
Ah, what happened? Okay, this one's good night.
night.
There's a guy playing a piano with his cat. Oh my god, his
that
cat's
cat is
falling
so
asleep
cute.
on the piano.
He's like, oh, just play a couple more
Oh,
rounds.
that's so sweet.
a couple more rounds, please.
Speaking of the polyvagal theory, there are certain
hilarious.
there are certain notes and tones that are stimulating to help you relax.
Clearly.
Clearly.
I
cat's
think
literally falling
I'm
asleep
gonna fall
sitting up.
asleep listening to this guy. Look, the cat is awesome.
That's very cute. His
He
shirt's
loves
funny
his
too.
cat.
That's really cute. Little sleep kitty.
Oh, look, he's out even a bigger picture of him. Oh my God. What is this? Game of Thrones?
No, but it's a wolf, all right. A bad dog owner dumped his wolf dog at a kill shelter when he got too big and too much to handle. Luckily, a sanctuary took him instead and saved his life. His DNA testing came back that he's 87% gray wolf,
Wow.
8.6% Siberian husky, and 3.9% German shepherd. Why don't they tell you how much this dog weighs?
And 100% I'm going to eat your face. Look at that. His head
looks
is like
pretty
3
sweet.
times the size.
Is that for realsies or is that like Photoshop? Wow.
Gosh.
That's
His head is ginormous. That looks like a Game of Thrones
it might be.
dog. What do they call the guys in the Game of Thrones? Harrison?
Dire wolves?
Dire wolves. That's a dire wolf.
It's a dire wolf. My friend is actually in Ireland right now, and she got to go on a Game of Thrones tour.
Oh, wow.
And she got to meet the adult puppies from season 1.
Oh,
Those
wow.
dire wolves. Remember when they find
Yeah.
the dire wolves?
Yeah.
She got to meet the actual, I don't remember their names now.
And then that's when Jon Snow saved them all because he's so nice.
You know nothing, Jon Snow.
Jon Snow. Oh, look at that French bulldog. Oh my gosh.
Two Frenchie puppies,
Yes.
and one's chewing on the other one's ear.
This is
and-
why people get French bulldogs. Look at that.
Oh, my heart.
I'll take 2, please.
That's the cutest. He's like, I'm just going to chew on your ear.
Okay, well,
Oh.
let's just fast forward past that part. No, I'm just kidding.
He's just letting him chew on his ear. Oh, bless you. Oh, he just got slapped.
He just got.
The bigger one said, I'm going to slap you.
Oh, they're
Oh,
cute.
babies.
They're
That's
very
really cute. I love little puppies. Little baby puppies. That's what everyone thinks we do. Just play with puppies. You know?
That's right. That's all we do. We never get pooped on. Oh my God, Harrison, you got to get Moose to do this. That dog is so happy.
There's a dog in a pool, and he's laying on 2 noodles, and he's like asleep, just floating in the pool. That
He
is
just chilling.
that sounds wonderful. I would love to do that right
Look
now.
at that. He's
Yeah.
on just noodles. That is hilarious.
Just noodles. Just sleeping inside the pool on 2 noodles.
Do they like wake him up? Does he like move? Is he alive?
I hope he's alive.
Oh.
Dog reaction to getting food. It's a pig
That's a
ear.
pig ear.
It's a pig ear.
I guess I'll take it. Okay.
Oh. Okay, so this dog, it gets handed a pig ear, and he's all reluctant to take it. And then he finally takes it very gently, walks away,
Sets
puts
it down.
the ear down, and then proceeds to jump up and down, all excited that he got food. That's pretty cute.
That was cute.
That's really cute. All right, my cousin has an Instagram for his dog, Boone, who has over double the amount of followers I have because, well, I'll just show you. All right, here we go. Here we go. We're watching here.
Beer me.
Oh, I've seen this. Okay, so the guy says, beer me. The dog goes to the fridge, pulls the fridge open, grabs a can of beer, delivers it to the owner.
Shut the door.
Goes back to shut the fridge,
Oh my god, that's so awesome.
gets a koozie for the beer.
Good boy. Here. Throw this away. Throw it away.
He takes the dirty,
Throw it away.
oh, he opens the trash can, takes the empty can.
Oh, he needs to be a service dog.
Yes, he does. And puts the empty beer can in the trash.
And go.
Good. Shut this door.
And then he closes the trash can.
Good boy.
Oh my
That's
gosh,
adorable.
That's so cute.
If I tried any of that, Wilford would be like, get out of here.
Oh, you gonna get
Thank
me the
you,
beer?
bud,
That's
no.
what my dog would say. You
that's
get me a beer?
true.
That's awesome. Thanks.
Very true. That's funny. Those are good.
Is that all you got so far? That's it.
That's it.
Okay.
We got it.
Okay. Well.
All right. Well, we'll be back next week then.
Oh wait, hold on though. I wanted us to go because I thought last week when we did our outro.
Oh, yeah.
Okay, so we've got to. If I could get my.
Are you doing and picking a song?
Yeah.
All right. Well, she's trying to find a song. We will, no, we'll be back next week. Catch our episodes on YouTube, Facebook, Spotify, iTunes, all those good places. Googles. Send us your questions, asvcpodcast@gmail.com. And leave us a review. You can also send your questions to us on Facebook and Instagram.
We're going
We
out.
will answer whatever you want.
We're going out with an oldie but goodie.
I'm Katie Ray.
I'm Dr. King, and we'll see
That's
you
Dr.
next
King.
time
Yeah.
on the podcast.